Mr. Walden. Mr. Doyle.
Thank you, Mr. Chairman. We've been tasked with a massive undertaking, the most sweeping reform of our nation's health care system in years. Mr. Chairman, each of us have heard countless stories from our constituents about their problems with our health care system, from patients who are denied the treatments they need, to those who have their insurance canceled, to those who are denied access to health insurance after they lose their job because of a pre-existing condition, to good doctors and medical school students who take issue with the system's disincentives to provide primary care, to hospitals that serve large numbers of our uninsured population, to insurance companies who are crowded out of the market by dominant firms, to consumers who don't understand the information about their health care coverage and treatment options, and countless other stories. Mr. Chairman, your bill attempts to address these issues, and as I said, it's a massive undertaking. As this markup proceeds, I want to make sure that we don't overlook anyone, any family with a disabled child, any person in need of protections that this bill affords. Mr. Chairman, you know how committed I am to making sure that this bill affords families with children on the autism spectrum access to the early diagnosis and interventions that can lead to significantly improved outcomes. I fear that the current bill as written falls short in that area, and that these families and these children may be left behind. That would be unacceptable, Mr. Chairman, and I could never support a bill that left these families behind, as this is a disease that is affecting 1 out of every 150 Americans. Mr. Chairman, you have my commitment that I will continue to work with you during this markup to make sure that we get coverage for these families, that we don't leave anyone behind, and that we get this bill right. It is a massive undertaking. It's very important to the American people that we get it right. I think we should take our time and make sure we do. I look forward to continuing to work with you, and I yield back.